Today is Swedish massage techniques. Like I said before, this is literally the foundation of every massage move in America. Question already?
No, I just wanted you to know that Ari's on her way.
Okay, cool. Awesome. That means we're just waiting. I don't know if Amber's coming today. So there are 7 common massage or Swedish massage techniques, and these are them. You guys already learned one last week. Number 1, static. Remember, that's non-movement. Number 2, effleurage. Then we have petrissage, friction, vibration, a lovely thing called tapotement, and joint movement. Now we're going to break down each one and then practice later. So some of our static methods, remember, we're not moving, would be techniques that include stationary touch, ischemic compression. I'm going to go over all this with you today. Trigger point work can be considered static, and a fancy method called muscle energy technique. That'll be a little further down the road that you guys will learn that. It's a little more in depth. When we're using static methods, we are using fingertips, the entire hand, our thumb, something called a braced thumb. So a braced thumb is when you take the thumb you're working on and you put another finger or thumb or hand over that to keep it nice and straight like a brace, right? So that's what that means. And then forearm and elbow. We're using everything from elbow down to the fingertips to work on somebody here. There's 3 actual techniques that fall under the category for static method. That would be your superficial touch. So that's literally just placing your hand on somebody like we did last week. Then we have something called deep touch. So that's when you're applying touch without movement, but it's with more pressure. Then we have something called holding. And we'll use a lot of holding techniques during massage, especially with the limbs, or if we're doing range of motion stretching, or just to start off the massage when we're applying touch to the client. Effleurage. Effleurage is a fancy word that means gliding. It is the most used Swedish technique in Western massage. And Western massage is what we do. The most important part of it is it introduces touch and it helps us gather information. So when we're doing effleurage, we're kind of also palpating. Remember that word from last week? Effleurage is used to spread your lubricant on the body part that you are massaging, nice and evenly. It is generally a smooth, continuous glide that does not lose contact with the client's skin. So every starting move, unless it's compression, tends to be effleurage, and every ending move tends to be effleurage. So you kind of do something light. If your client wants deep tissue or a more firm hand, then you get into those techniques, and then we always end it with this soothing effleurage touch. Applications. Most of these applications are going to be kind of the same thing. Fingertips, palm, something called a soft fist. So that's a fist, but you're not really tightening very much. It's nice and soft. I can easily just grab it and kind of collapse your fingers into your hand with a soft fist. And your forearm. You guys are going to learn using your forearm is awesome. So it feels good. It's a broader surface. It's nice. There are 4 effleurage techniques we're going to go over today. One is called aura stroking. we're not even touching the client. So have you heard of everybody having like an aura, like an energy field around them? That's generally what we're doing. So aura stroking, a lot of that goes hand in hand with energy work. Like, we're not going to just be doing aura stroking on our clients and be like, all right, your massage is done. Then we have something called feather stroking. We did a little bit of that last week too, where there's nice superficial stroke. Think of it light like a feather, and it feels good. Feather stroking is kind of that ending stroke that we do because it feels nice. We have something called superficial gliding. That is just your basic normal effleurage glide. Then we have deep gliding. Same technique, more pressure. And in this picture here, the person with the hand above his head, that's the aura stroking. And she actually has a static touch on his sternum. So that's what's going on there. Petrissage. I would say this is probably the second most common stroke in massage. This is when you think of kneading. You're squeezing that muscle, feels real nice. The purpose of petrissage is to loosen muscle tissue. It reduces muscle atrophy, so muscles that are weak or not really functioning well anymore and have gotten smaller, that would be your atrophy. It actually can enhance your muscle tone there. Increases local circulation, and it makes your muscle tissue more pliable. Just think of, I'm probably way too old to use this reference, or you're probably way too young for this, but do you guys know what silly putty is? So when you first take it out of the little nutshell or the little eggshell it's in, it's hard as a rock until your hand warms it up and then it starts becoming more pliable. That's what we're doing with people's muscles. Now, their muscles are generally not going to be as hard as that putty is right out of that container, but that's my example. In petrissage, there's something called skin rolling. That's what this picture is. You're literally kind of pinching, not hard, pinching the skin between two fingers and rolling it. When we're doing this, we do not use lubricants because you can't actually pinch the skin. It just slides right out from under your hand. When kneading, typically both hands or fingers are used. Techniques would be actual kneading, something called fulling, skin rolling, and ringing. Alrighty. Good stuff. Then we have friction. Just like the skin rolling, we're using no lubrication or very little lubrication. Now, if you're massaging someone and you realize, oops, I just put lotion on this area and I don't want lotion because of the technique I'm trying to use, you can just use the sheet to wipe it off a little bit. Or some therapists keep extra hand towels in their office, so you can just kind of wipe it off a little bit. Why do we need to do friction? It causes something called superficial hyperemia, so reddening of the skin and the tissue. It actually helps to stretch and broaden the tissue that we're working on. It can break down connective tissue adhesions. That's what we're calling knots or trigger points. It promotes more pliable scar tissue, so it helps with scar tissue healing and tightness. And it's a mild therapeutic inflammatory, or it causes inflammation mildly, which we need that to bring blood and oxygen and nutrients to the area. What parts of our hands do we use for friction? Typically the palm of the hand or the fingertips. There's something here that's called cross fiber. Cross fiber friction is the main tool we use for scar tissue work. Now we have the types of friction. Superficial friction. So that's kind of just something like that. Now, I'm doing this with my hands. I'm rubbing them together. Friction doesn't necessarily have to be fast, all right? You can still do a slower technique and get the same effect here. We have something called deep friction. With deep friction, we're usually using more of our fingers, or digits, we'll call them. And we use something called circular friction. So literally, that's just jamming your digit into somebody and moving in a circular way. We have that cross fiber friction. And we have something called longitudinal friction, also stripping. Rolling is a form of friction. Something called chucking and compression. I don't know why they threw compression into friction, but I don't think it is. Vibration methods. Now, most of us no longer do a lot of these vibrating or oscillating methods because now we have tools that'll do it for us much better, like the massage theraguns and stuff like that, different tools. Have you had anyone work for or went to a chiropractor or PT and they have this big machine and it vibrates? It's like a big, I call it a muscle buffer. That's also an oscillating tool. The main purpose of vibration is to increase circulation and relax the muscles, but a lot more quick than your normal techniques, a lot quicker. Vibration can be used to assess tension or restrictions, more so with the limbs. So if we do something called manual vibration, that's with our own hands, you can get about 5 to 10 vibrations per second. If you use a machine, you can get 10 to 100 vibrations per second. That's why it's so, it's taken our job basically for that type of technique. So when in doubt, get a massage theragun. Applications, hands and soft knuckles. And I'm going to show you guys the vibration with the soft knuckles. It's actually really taxing on your body. I don't recommend doing it. Bless you. Now, the ones I do recommend doing would be these top 3. Shaking, just how it sounds. Jostling and rocking. And the vibration last could be manual or mechanical. But like I said, I don't know anybody who uses manual vibration as a technique. They should just stop teaching it. Tapotement, also known as percussion. So these are techniques that are simultaneously used, or you use alternating hands. So simultaneous is same time, alternating, obviously alternating each hand strike. Reason for this technique, it tones and stimulates the tissue. It's got a little bit of an anesthetic effect, so it numbs and calms things, the nerves specifically. It increases circulation, and there's a technique called cupping, not to be confused with those plastic cups or the glass cups that we put on people, but it's a hand technique, and this is used to break up congestion in the lungs if somebody's getting over a cold or something. Tapotement applications, fingertips, so that would be used for tapping. So tapping, the only time I really use tapping is on the sinuses, so you would just kind of use the tips of your finger and kind of tap along the sinus cavities on the face. Then we have cupping. This is when you use your hand as a cup and strike the person. If you hear that noise, that's cupping. Slapping. Don't slap your clients. This is a technique, but it's weird. Literally, you are smacking a client. Not very hard, but kind of like smacking them to stimulate blood flow. Real weird. That's when we're getting into some of the weird parts of massage, if you know what I mean. The illegals.
Keep a reputation.
Yeah, smacking clients.
That little old lady slapped the shit out of me. And it took me back, like I was relaxed as ever, and then at the end, you know how and then she just started
Smacking. Like,
I'm getting up now.
you're like,
I
damn,
gotta-
yes, I'll get up. Okay, sorry, I won't take my time. So slapping is a technique. We don't use it really for real. Ulnar border of hand is called hacking. So in this picture here, the karate chop, that's called hacking. And then soft fist, we use a soft fist again, not a hard one, and we can kind of do something called beating. Beating is used a lot with a chair massage because with chair massage, we're not using gliding strokes. We're now using either more kneading strokes or percussion. So yes, you can beat the hell out of someone on a chair.
I do that to my family when they're like, "Can I get a massage?" And I'll be like,
You're like,
"Yeah,
yes."
use this new technique."
Slapping and beating. They'll never ask you for a free massage again.
Thank God.
So we'll learn all those. We get to slap and beat each other today. What did you guys learn in class today?
We smack
Abuse.
each other around.
The last movement is joint movements. This is used to improve joint mobility and range of motion or to kind of test range of motion. You can do it at any points during the massage. It can be done before or after the treatment, in the middle of your treatment, right? And if you do it before and after, I would suggest taking notes on any changes. If maybe the range of motion improved, worsened, stayed the same. There's passive and active techniques. Passive means the client remains relaxed while we, the practitioner, moves the joint through their normal range of motion without pain. If there's pain, we stop. And they just lay there and we do all the work. Then we have active. This is when the client actively participates with the movement. So I might bring them through a range of motion technique while they are helping me. I don't use a whole lot of active, but that's my personal preference. I don't. Under active, we have two other categories, just for fun. We have active assistive. This is when the client tries moving the joint and the therapist assists in the same direction. So usually with active assistant, the client starts. So I'll use my shoulder as a reference. I'm going to start moving my shoulder and then the client will help bring it in. This is good if somebody's having pain or weakness in a joint so they can kind of start it and you can assist, hence the name. And this is one I do use a lot because it's part of muscle energy technique, that fancy one that you guys will learn. It's called active resistance or active resistive. This is when the client tries moving a joint and the therapist counters movement in the opposite direction with a hold. You're like, what does that mean? You will learn, don't worry. So then again, I have this, even though it went over on the left, just on the right, it tells you what is joint movements, active joint and passive joints. Anybody have questions about these techniques? No?